Yes, I'm Dr. Monisha. Welcome to One Question at a Time series. Sorry for the delay. It is because of this Squid Game, the challenge, the second season. And I was thinking if people could watch this one, then why not watch my videos? Hmm? It is definitely you can definitely watch my video if you are able to watch Squid Game, the challenge. Okay. So we'll move on to today's question. The key to the root of the neck is scalenus anterior muscle, which we all know. Which among the following is true about scalenus anterior? Okay. Is it not pierced by phrenic nerve? Is it attached to the scalene tubercle on the second rib? Is it that separates the subclavian artery from the subclavian vein, or is it pierced by the phrenic nerve? Okay, the competition is between these two. Okay, is it not pierced by phrenic nerve, or is it pierced by phrenic nerve clearly? So let us see a few things about scalenus anterior muscle. Okay, the scalenus anterior muscle is the origin is from the anterior tubercles of the transverse process of C3, C4, C5 and C6 vertebra, and the muscle has a slender tendinous insertion into the scalene tubercle of the first rib. Okay, it is a scalene tubercle of first rib. Okay, so see the options here. It is not the scalene tubercle of the second rib, it is a scalene tubercle of first rib, so which is not true. Okay, so the insertion is into the scalene tubercle of the first rib, and okay, because the origin is from C3, C4, C5, C6, what will be the nerve supply? It is by the C4, C5 and C6 spinal nerves, the ventral rami of C4, C5 and C6 spinal nerves. Okay, so the insertion is into the scalene tubercle of the first rib. Okay, then this is a picture of the first rib, and we have two grooves, one on the anterior and one on the posterior aspect of the scalene tubercle. So the anterior groove is for the subclavian vein. The anterior groove is for it is formed because of the passage of the subclavian vein, and the posterior groove has formed because of the passage of the subclavian artery. Okay, so it is understood that this scalene muscle, the scalenus anterior muscle, okay, separates the subclavian vein from the artery. Scalenus anterior muscle, in its anterior aspect we have the subclavian vein running, and on its posterior aspect we have the subclavian artery going. Okay, so this one thing is clear. Okay, so we'll see that in a picture. Okay, here you can see the scalenus anterior muscle. Okay, to its anterior you can see the subclavian vein, and to its posterior you can see the subclavian artery. So also here you can see clearly its insertion into the scalene tubercle of the first rib, and you can see the subclavian artery running posteriorly. So as we all know, scalenus anterior muscle divides the subclavian artery into three parts. The part which is medial to the scalenus anterior, the part which is posterior to the scalenus anterior is the second part, and the part which is lateral to the scalenus anterior is your third part. So we have the first, second and third part because of the scalenus anterior muscle. So we are talking about the arteries. So we'll see. So as the scalenus anterior muscle divides the subclavian artery into three parts. Okay, from the first part we have a branch called the thyrocervical trunk. of which we have two branches, namely the suprascapular artery and the transverse cervical artery, which is seen to run anterior to the scalenus anterior, while the subclavian artery itself is posterior to the scalenus anterior. These two arteries from the thyrocervical trunk of the first part of the subclavian artery, the suprascapular artery and the transverse cervical artery, runs anterior to the scalenus anterior. Okay, so and then you can see another picture uh, where the subclavian, where the suprascapular artery and the transverse cervical artery are running anterior to the scalenus anterior muscle. Okay, so see the suprascapular artery, the transverse cervical artery and the suprascapular artery, and you can see these two structures are pinning a structure to the anterior surface of the scalenus anterior like that of a stapler. See, if you have to keep a thing in place, okay, you need staplers to fix the two things in place like that. You can see the transverse cervical artery and the suprascapular artery are keeping a thing in place, and this thing is your phrenic nerve. Okay, so the phrenic nerve is on the anterior surface of the scalenus anterior, which is kept in its place by means of the transverse cervical artery and the suprascapular artery. So one another structure that is anterior to the scalenus anterior is your phrenic nerve. While we are talking about arteries and nerves, we will talk a little bit about veins. Okay, we all know that the subclavian vein runs anterior to the scalenus anterior muscle. Okay, so what is the other vein that runs anterior to the scalenus anterior muscle is your anterior jugular vein. You see, this number 4 is your anterior jugular vein. It has its course like this. Okay, so you can see the anterior jugular vein here. So the anterior jugular vein starts from the submental triangle, and you can see its course. It is going down on the longest colli muscles, and it is turning laterally, and it is running over the carotid sheath and its contents. Okay, while carotid sheath and its contents itself is anterior to the scalenus anterior, this anterior jugular vein also is supposed to be anterior to scalenus anterior. Particularly this transverse part, this horizontal part of the anterior jugular vein is meant to be on the anterior surface of scalenus anterior. Okay, like not immediately anterior, but it is on the anterior aspect of scalenus anterior. Okay, so this anterior jugular vein, so we have the two veins, the subclavian vein and the anterior jugular vein. Here you can see one another picture. See here, this anterior jugular vein from the submental triangle, it is starting and it is coming down, and it is having a lateral horizontal course deep to the sternocleidomastoid muscle, over the surface of carotid sheath. Like as I said before, carotid sheath itself is anterior to scalenus anterior muscle. So the anterior jugular vein is also on the anterior aspect to scalenus anterior muscle. So we have the anterior jugular vein. Okay, and we'll see a schematic picture of the anterior relations. Like I said, okay, so we have the suprascapular artery, transverse cervical artery. We have the phrenic nerve lying deep to the prevertebral fascia, which I'll say later. But we have the phrenic nerve. We have the two veins, the subclavian vein and the anterior jugular vein, represented by a circle. Why it is represented by a circle? Because of their horizontal course. At that region, the subclavian vein is also having a horizontal course. The anterior jugular vein is also traveling horizontally, which on the cut section, and when we look from the lateral aspect, will be represented by a circle. So we have the subclavian vein and the anterior jugular vein, and we have the two muscles, the inferior belly of omohyoid and the sternocleidomastoid. The inferior belly of omohyoid also will have an oblique, almost transverse course. Okay, so that is represented by a circle. Okay, so we'll see about the muscles. So you would have all known about the posterior triangle. Yes or no? The posterior triangle formed by the sternocleidomastoid, trapezius, and the clavicle. So the posterior triangle, one of the flow muscle for the posterior triangle is the scalenus anterior muscle and the inferior belly of homohyoid muscle. So you can see very well that scalenus anterior muscle, on its anterior aspect, we have some part of sternocleidomastoid, and we also have the inferior belly of omohyoid. So what are the anterior relations? We have the two arteries, namely the suprascapular artery and the transverse cervical artery, and we have two veins, namely the subclavian vein and the anterior jugular vein. We have one nerve, the phrenic nerve. Okay, the phrenic nerve, and one sheath, the carotid sheath. Okay, one sheath, and we have two muscles. Okay, the sternocleidomastoid muscle and the inferior belly of omohyoid, and one bone, and that is your clavicle. Okay, one bone is your clavicle. Okay, so this is about the anterior relations of scalenus anterior. Now you would have known why scalenus anterior muscle is called as the key muscle, and that's not it. You have the posterior relations. Okay, and scalenus anterior muscle and along with the other scaleni muscles form the paravertebral group of muscles. The paravertebral group of muscles, along with the prevertebral group of muscles, they are all covered by this prevertebral fascia. Okay, here I have the prevertebral fascia, and we have the emergence of this ventral rami of the spinal nerves between the scalenus anterior and medius. So this ventral rami is going to contribute to the brachial plexus and the other nerves like phrenic nerves. Okay, so where will be your brachial plexus? Okay, the brachial plexus will be posterior to your scalenus anterior within the prevertebral fascia. So where will be your phrenic nerve? The phrenic nerve will be running on the anterior surface of the scalenus anterior, but it will be deep to the prevertebral fascia. That is what I am coming to say. Okay, the brachial plexus will be seen posterior to the ventral rami of the spinal nerves. Cervical spinal nerves is going to form the brachial plexus. So the brachial plexus will be seen posterior to the scalenus anterior within the prevertebral fascia, whereas the phrenic nerve running on the anterior surface of the scalenus anterior will also be seen within the prevertebral fascia. Okay, so here is your picture showing the roots of the brachial plexus posterior to the scalenus anterior. So, okay, while the roots of the brachial plexus are lying posterior to the scalenus anterior, the trunks will be seen emerging from the lateral border of the scalenus anterior muscle. Yes or no? Okay, while the roots are seen posterior, the trunks are seen on the lateral border of the scalenus anterior muscle. Okay, so we have the subclavian artery also is seen. See, the subclavian artery also is seen lying posterior to the scalenus anterior muscle. When I say that it is lying posterior to the scalenus anterior muscle, it is also covered with the prevertebral fascia. Yes or no? It is also covered with the, here is your subclavian artery. If it is running posterior to the scalenus anterior muscle, it is also within the prevertebral fascia, and subclavian artery will continue as axillary artery. So what will be the continuation of prevertebral fascia for the axillary artery region? The prevertebral fascia is also seen continuing into the axillary region. And what is it called in the axillary region? You should comment in the comment section. Okay, so posterior to the scalenus anterior is your brachial plexus and subclavian artery, and on its lateral aspect we have the trunks of the brachial plexus. So what are the other posterior relations? Okay, the other posterior relations are here. See, if the insertion is going to be on the first rib, okay, the insertion is here. So the cervical pleura along with the suprapleural membrane is also posterior to here. The cervical pleura with the suprapleural membrane is also posterior to your scalenus anterior. And your question is, suprapleural membrane is a remnant of which muscle? Suprapleural membrane is a remnant of which muscle? Okay, and that is your question. So this is about the posterior relations. And coming to the medial relations, medial to the scalenus anterior, you have a triangle called the scalenovertebral triangle because of the important content of the vertebral artery. You have so many other contents here. So medially you have the scalenovertebral triangle and its contents. Okay, so laterally you have the scalene triangle between the scalenus anterior and scalenus medius. You have the scalene triangle and its contents, where the trunk of the brachial plexus is there, and you have the subclavian artery. So scalenus anterior has anterior relations, the two arteries, two veins, one nerve, one sheath, okay, two muscles, sternocleidomastoid and inferior belly of omohyoid, and one bone, that is your clavicle, and has posterior relations, the roots of the brachial plexus, the subclavian artery, cervical pleura with the suprapleural membrane, and you have the other scalene muscle, scalenus medius muscle on its posterior aspect. Yeah, we have the medial scalenovertebral triangle and its contents, and laterally we have the scalene triangle and the contents. Okay, so it has so many important relations. That is why it is called as a key muscle of the cervical region. So coming back to the question, it is not pierced by phrenic nerve. The scalenus anterior muscle, it is not pierced by phrenic nerve. The phrenic nerve just runs on the anterior aspect of the scalenus anterior muscle, and it is kept in place by the two vessels, namely uh, the suprascapular artery and the transverse cervical artery. That is all. It is not pierced by the phrenic nerve, and that will be your right answer. Okay, it is attached to the scalene tubercle on the first rib, not the second rib, and it separates the subclavian artery from the subclavian vein is also a correct option. Okay, it separates the subclavian artery from the subclavian vein, and it is pierced by phrenic nerve is a wrong answer. So here we have two answers. It is not pierced by phrenic nerve, and it separates the subclavian artery from the subclavian vein. So look at the picture and tell me your diagnosis in the comment section. The clue is here. Okay, tell me your diagnosis in the comment section, and the test is done for the diagnosis of the previous picture. Please comment on the comment section about this test, and which is called as the anatomical Bermuda triangle. Which triangle? We talked about Posterior triangle, we talked about scaleno-vertebral triangle, we talked about scalene triangle, and which triangle is called as the anatomical Bermuda triangle. That also you should comment in the comment section. And another question I asked is, what is the continuation of prevertebral fascia in the axillary region called? Okay, you should also say that in the comment section. Thank you guys.